I want to note that this program is brought to you as a collaboration between these different organizations and the Southern Tier 8 Regional Board out of Binghamton. And I believe Jen Gregory is also here with us today. So this presentation will provide an overview of the New York State Coalition to Prevent Addiction and Support Recovery and Employment, otherwise known as PARSE, the work that Ken's doing at the Gino Macchio Foundation, and the role of recovery-friendly workplace initiatives and models for preventing adult worker substance use and addiction. So I'll begin by talking about these three overlapping approaches to doing this work. The first, the recovery-ready workplace. Second, the recovery-relevant prevention. And third, putting recovery to work. The different organizations here more or less represent these different focus areas. PARSE is really about the recovery-ready workplace. The Gino Macchio Foundation is about putting recovery to work and the recovery-ready workplace. And Team Awareness New York, which I'll be talking about, is about recovery-relevant prevention in both of those areas. So there's a lot of overlap here. What do we mean? Very briefly, as a brief introduction, recovery-ready workplace is what employers can do to support recovery. The importance of numbers of different case studies that Allison will be going over and introducing Ken. The role of pain and the role of prevention. Putting recovery to work, different methods that Gino Macchio has been doing in terms of reducing barriers, providing opportunities with many case studies and stories. And we'll be talking about evidence-based prevention using psychoeducational approaches that reduce stress, build social capital, and also incorporate recovery-relevant messages. So I'll turn it over to Allison, who will begin this first part. Allison Weingarten from PARSE.
Thank you. And it's good to see a couple names that I recognize here. So I am here representing the PARSE Coalition. We started, basically our kickoff was February 2022. So we are over 3 years strong at this point. And we are a coalition. I was with Friends of Recovery New York at the time when I started it. And we are committed to creating a culture of recovery supportive workplaces within New York State that actively develops resources for preventing substance use and addiction. And so we have been active for a few years, and we strive really to bring a coalition approach, although always keeping that recovery lens at the forefront. But there's so many different components of the recovery-ready workplace that we want to bring in all of these different players, whether it's people in recovery, employers, businesses, nonprofits, human resources, we need all of these different components in order to make this happen. And so in New York, we are really focusing on a really comprehensive approach. Next slide. So my goal for this presentation, and when I give these presentations, is so that you understand the benefits of a recovery-ready workplace, and you understand how to support workers who are struggling. Next slide. So hopefully by the end of this, you will know how to describe the impact of the substance use crisis, specifically on employers, workers, and communities, explain the connection between hazardous and stressful working conditions, and self-medication with alcohol and drugs, understand the benefit of employing and retaining people in recovery, understand the difference between drug-free workplace with the recovery-ready workplace approach, and hopefully we'll have some time at the end to brainstorm how to initiate recovery-ready workplace programs. So something really important, I think many of you may know Friends of Recovery New York, which is the recovery community organization around the state. Our own personal stories are very important to this. And sometimes this is actually very tricky when we're working with employers, because employers, I'd say, and the general population is used to keeping these stories to ourselves. But storytelling has been really important to the recovery movement, and that is also true when we're bringing recovery into the workplace. And as Ken will tell you later, we see these personal stories really as a gift, and even a gift to employers. So next slide. So many of you are very familiar with recovery. I know many of you are from prevention. We work together. Many people in prevention I know have a connection to recovery. So when we're thinking about recovery in the context of the workplace, sometimes it's a little different than general recovery. But it could be applying to workers who have had an accident or an injury, and they are recovering from those. And it also applies to those recovering from substance use disorder. Next slide. We do interchange recovery-friendly workplace with recovery-ready workplace. Some people like one term more than the other, but it did start out as recovery-friendly workplace. This is the logo that they have utilized. It started in New Hampshire, although I know it's been going on forever without a logo. People have been doing it and supporting people for a long time, but it really did get a start nationally in New Hampshire, where there was a big initiative through the governor of New Hampshire, Governor Sununu at the time, actually ran a ski resort, and he noticed that his employees were struggling with addiction, and he started to see that and see that as a way to keep his employees, support his employees. And when he became governor, he made it into a whole initiative, and they are going strong. They have reached out to hundreds of employers to help them become certified as recovery-friendly workplaces. So I'm sure you are all familiar with the zero tolerance policy. This is more of a holistic approach, which I will share about now. So in order to become a recovery-friendly workplace, you're committing to creating a recovery-friendly workplace. Ideally, you are collaborating with employers, unions, and communities. You're creating a culture that reduces stigma, improving safety, and supporting injured workers. Many of you may know that workers who are more likely to get injured are more likely to use medications, which can lead to substance use disorder. So that's a huge part, is just keeping workers safe in the first place. Utilizing protective equipment that doesn't lead to workplace injury and stress. Identifying and addressing work stress and mental health issues, and offering those insurance benefits that actually cover those conditions, and acknowledging recovery as a strength. Next slide. You may or may not know, I know in this community, we're always talking about how we're actually saving money and trying to put that forward when we're advocating. But this has been proven that you do save money when you're hiring people in recovery, when you're supporting them rather than firing them. So you have reduced absenteeism, healthier work environment, greater productivity, lower healthcare costs, greater workplace safety, employee retention, and a positive reputation in the community. Next slide. And there have actually been studies that show just actually a dollar amount of how much these businesses can save. So this is information if you're ever trying to make the case. In addition to the human component, you can share the actual dollars saved. Next slide. And folks should know that you may not want to talk about recovery in the workplace, but you should know that people with substance use disorder are working. So why not address it? And what is the impact on the workplace? There is lost productivity, absenteeism, and presenteeism. I don't know if you're familiar with presenteeism, but that can be that you're on the job, but you're not really fully there. So addressing these issues is really important. Next slide. And then not treating these issues can lead to job loss, stress, financial ruin, of course, divorce, loss of child custody, prison, and death. Next slide. And now I'm going to let Ken Daly talk about one of our examples of a recovery-friendly workplace program. Of course, they take different shapes everywhere, but Ken is really doing incredible work that I wanted to share with you. And then I can share a couple other case studies.
The way I found out about the Gino Macchio Foundation is through Hope House. It's a long-term, non-traditional rehab that I was at a couple times, and this foundation kind of fell in my lap, I guess you could say, through Charlie Russo and Father Frank and all the great people they have working there. I've been in this process for so long, in and out, in and out, in and out, and I think over time it's really been difficult to kind of get off that empty feeling of beginner job after beginner job, and kind of grow from anything. And I think this kind of gives you a little bit of security, whether it's a car or rent for the year or whatever it is, and there's a better way of living, and I think finding the people that are doing the right thing, like a place like this, and Hope House, it's we need that. I need the help, and I think sometimes that's hard,
Basically, what to give everybody an idea of what we do is, we believe that any solution to a lifetime of continued recovery is a team effort. We believe that it's a war against this scourge, and that everybody has a role to play. And the more we can work together, provide a recovery-friendly workplace for people to land, remove the barriers that they encounter often when they're leaving a rehabilitation environment, get them give them access at least to meaningful employment, not the constant first start jobs. And we realized that the only way to do this is get some boots on the ground and just really analyze it in the most simplistic way. So what we do simply is we aim to focus only on removing barriers to employment. Our method of finding scholarship recipients is we rely heavily on the input from their current counselors that are launching them back into a life of recovery instead of rehabilitation. And we kind of follow like an athletic scholarship or a college scholarship role. When you get recruited to play sports at a college, the first thing that college coach does is he calls your coach. He doesn't call your mom, your dad. And the coach tells the truth. And we've found that by cultivating relationships with counselors, we're getting scholarship applicants that are ready to embark upon that life. And in business, I come from a business background, and in business, there's always the repetitive condition that you look for in your business to remove, the problem. Normally you can identify a competitor. We learned there's basically 5 things that major barriers in our area, transportation, housing, counseling, re-education in a new job. And what I mean by that is maybe vocational training, and we call it a one-off. So those are the expenses we try to discover in our onboarding process of a scholarship winner. And the one-off is just as important as the others. The one-off piece is the personalization of the recovery journey. And it's working wonders, frankly. And so we provide the funding to remove barriers that contribute to the stigma, meaning you go on a job interview, you have a gap of 12 months in your employment history, you're on the defensive, right? Well, what we provide in our put recovery to work program are we ease the person back into with it. We have an intern program, we call it, inside of that. And what we do is we get you public service jobs around, maybe in town where a little old lady might need her lawn cut, we'll cut the lawn, and we pay the folks to do that. The people in our scholarship program, we pay them a wage. We also assign someone who can write them a letter of recommendation, so they get a supervisor on site. And the reason for that is, well, when they go on an interview, we want them to tell the employer, well, look, yeah, I had that 12 months, I had an issue, I've overcome it, and here's the jobs I've done in the meantime, so I'm ready to get back to work full time now. Here's my letters of recommendation. I'll have 5 or 6 of them. I have transportation, although I don't have a car right now. I have transportation to and from work. I have an Uber account. I can go back and forth to work. So we try to overcome some of the barriers that employers would find unacceptable and contribute to the stigma. The other thing we try very hard to do is make the employment meaningful. So, for example, we had a scholarship winner who 18 months ago enrolled in school. He had some credits. He was in the medical field before. I forget, testing blood, whatever that, a phlebotomist. And he wanted to be back, become a nurse. A little emotional for me, but he just got a job with a local hospital conglomerate, $93,000 a year job. And he was living in his car 2 years ago. So it's been a tremendous success for us in the part of this issue that we're trying to solve. The other thing we do, for example, is if someone works in, maybe operates safety sensitive equipment, and he turns himself in, so to speak, we will normally, what happens if there's a program in place, which often is, they won't let that person go, but he'll go from operating a crane to sweeping the floor in a gymnasium or be a custodian. To me, that doesn't help anything, because when he started his journey into recovery, I'm sure he left behind some damage. I'm sure that seems to me there's always some financial damage. And demoting someone like that, there's no incentive whatsoever. As a matter of fact, they often can't turn themselves in, which is why they keep working. What we do is we bridge the gap between what the pay was and what the pay would be while he participated in his companies or unions process. So if he was making $50 an hour and he's now making 20, we'll reimburse the employer $30 an hour, so there's no benefit loss, no 401k loss. They can keep working. The employer's happy. They don't have to retrain a skilled person that operates this crane. And there's incentive for the person. Now, if he doesn't turn himself in and he gets caught, well, then he can't participate in the program. So we've seen some amazing results with that as well. And then finally, the final thing under our Put Recovery to Work is we offer local employees, mostly small businesses, a training for the first 30 days of employment. Will pay their salary. So there's no risk to the local small employer, which when I was an employer, I had less than 250 people. I had about 80 people. And it was always my concern that if I hired someone and they lasted 3 weeks and I had to let them go and they apply for work, they apply for unemployment, or they found the end coming and they had a trip and fall. So the first 30 days, you get a pretty good idea of the character of a person. You get a pretty good idea where their head is at. And then you can make the hiring decision after the 30 days. So we provide them with a resume. We provide them with strength to their resume. We provide them with, when they, the people that are scholarship winners have to find their own jobs and choose their own jobs. So I guess in a nutshell, those are the main points of what we're trying to do. And so far, we've been issuing scholarships for almost 2 years. We have 100 scholarship winners. No fatalities after the first 90 days post rehab. We have a 100% job placement that, well, we don't place the jobs, but we have every single scholarship winner is now working of the 100. Another success story is we had a young man come to us who was living in a bad situation at home. His brother and him were drug abusers. They were forced into rehab by law enforcement. He now operates overnight a $20 million facility. We sent him. He wanted to go. He wanted to learn about it. We sent him to vocational school to run a part of this facility. He was in a traffic accident. He didn't take any painkillers. He was so afraid of becoming addicted, and he didn't want to lose his job. So I think overcoming the stigma and confidence ended in this. I'll end my little point with this, that his mother came to us at one of our events and was in tears and hugged me and said, this past Mother's Day was the first time I've hugged my son knowing he wasn't high. And it was emotional for everybody. And he's such a hero, this guy. And we all have success stories. But the real success story is his mom was staying in New York for the two brothers. Well, his mom was able to go down to Florida to be with people. She wanted to move to Florida and retire. Stephen now bought the house from his mom and takes care of his brother. And his brother just won a scholarship with us. So we find it pretty interesting that when the stigma is removed and they go to an interview with some power, it changes their hiring percentage. And that's us. Boots on the ground. We're not OASIS certified. We have no counselors. We're never going to have counselors. We want to make sure we stay focused on our one mission, which is removing barriers, putting people to work with pride, putting them to meaningful jobs, and most importantly, giving them their soul back and their pride back. So it seems to be working. That's what we do.
And I want to make a comment, as I know, I believe you were open to taking questions at this point midway through.
Sure.
I do want to make a really, what I think we talked yesterday, many people on this call are working within grant-related, administrative, sometimes bureaucratic systems where the decision to implement some kind of strategy or program is often encumbered by sometimes short-term funding streams, the need to put all kinds of things to paper and all kinds of justifications. In contrast, and the reason we invited Ken is because they are boots on the ground just getting it done. They are getting it done without any of that. And so it's a very important lesson for all of us, because we sometimes can only see the work that we're doing from this, whatever you want to call it, technocratic perspective. And so I think it's important, that overlap that I showed at the beginning. We need to collaborate with people like Ken. We need to find ways to replicate what Ken is doing, because it's gotten overly policy oriented and administrative, whereas the real work is the work that Ken's doing. I just want to put in a big plug for the work that Gino Macchio is doing. And any questions for Ken before we talk about prevention?
Joel, I want to expand on what you just said. That's a very good point. I didn't know if this was the proper, but what we're willing to do is, and we understand that barrier, and it took us 4 years to get to this point with our grantor to allow us to really make the decision unencumbered by who we give the scholarship to and what we pay for. It's a long process, and I'm sure it's different, in every municipality or whoever's funding you. We purposely are not. We funded this for the first 2 years. We funded it personally. we wanted to make sure we could do it the way we wanted to do it first, and then packaged it to get our funding. We've made a commitment to not expand into the other areas. You know, we own real estate, we own things personally that we could easily become a full service, so to speak. We are available to anyone that wants to try to do this, either by referring your patients to us. There's no danger. We're not going to take them. We're not going to become, and we'll get them scholarships. Once, if that's what you do, we'll get them scholarships. It doesn't matter. Or we can help you if you'd like. We will share every single thing. We made a manual as we went along. So we probably made 10,000 mistakes for every success. So you don't have to go through it. We will share it with anyone that wants to know what's going on. And hopefully you can get funding and run it. So I just wanted to add that.
Yeah, any questions for Ken or Allison? Go ahead.
Yeah, I just put in the chat, and I didn't even bring this up on our call yesterday, Joel. And I think many of you do work with Oasis who are on here. But there is a procurement opportunity, which is about getting people in recovery to work. Obviously, it's probably going to have more restrictions coming from Oasis. But I definitely encourage you to take ideas that, you know, Ken has been sharing. And if you're interested in applying, using some of those ideas in the application, there are 28, there will be 28 awards made, divided up between upstate New York and New York City and Long Island, downstate. I put that opportunity in the chat.
Yeah.
Before we move on, any questions for Ken? He has a lot of knowledge and wisdom, and I want to make sure we may have time at the end as well. I'll only be talking for a few minutes, so. You know, our goal today is to really foster collaboration. And the idea that we only can receive funding and do the work that we're doing within our own silo, we need, especially with federal funding these days, and a lot of what I would call fragmentation in many systems, we think that this particular procurement opportunity could be strengthened by showing collaboration. So whether you want to talk to Ken or Allison or us, Dan Willett is also here. He's going to put his contact information from LEAF. Jenna Gregory is here from Southern Tier 8. She'll put her contact information in. You'll be seeing some of the work we're doing with her. And the times are different now than they were. And the issue of substance use in the workplace and among adults, especially emerging adults transitioning to the workplace, is as significant a problem now as it ever was. And we also have data showing that parents who are in the workplace are also misusing, and they're raising children. So we need to do a better job of collaborating beyond the drug-free workplace model to validate those who are in recovery and destigmatize workplaces as healthy places for them to grow and thrive. And as Ken has over, I think, 100 case studies now of people who are thriving, who are once in recovery. So what I'm going to do is share the work we're doing on prevention so that you can see that this is our leg of the stool, if you will. Allison, I'm just going to go to that. I want to say that in Allison's presentation, she does talk about many of the things that we talk about in terms of healthy alternatives for pain, increasing access to treatment, and creating a more proactive approach, which is what we're talking about here. So I want to acknowledge Southern Tier 8, Jen Gregory, for the funding and for this. Team Awareness New York initiative. We have a number of people on the call who are involved in Team Awareness. If you want to share your contact information, I think Jen Farringer and Cara Cloud from NCAT out of Rochester area is here. Again, Dan is here from LEAF. So what is Team Awareness New York? This is something that was originally funded from OASAS, continues to have funding from OASAS, but also is partially supported from Southern Tier Regional Board. And you can see the different counties that we are in, and we provide 3 different types of training. The ripple effect of well-being, which is about building social capital and interconnectivity between oneself, one workplace, and one's community. Resilience and Thriving, which is about transformational approaches to stress. It's a cognitive behavioral program. And Empowered Health Consciousness, which is just as it sounds, making people more health conscious. And these are 3 different programs that Dan and Jen and Cara and we also deliver. I think Amy Fahey is here from Herkimer County. Yeah, hi, Amy. So she's also doing a bang-up job, and she's a master level trainer, so she can get you trained if you're interested. These are currently free through OASAS funding. They're each presented in the classroom to 8 to 25 participants from 90 minutes to 180 minutes. They're classroom, they're live. They are always integrated with promoting employee assistance programs and wellness. So far, we've reached close to, I think, 4,000 participants in communities, workplaces, coalitions, associations. This can be done for community-based organizations, profit, nonprofit, public and private, small, medium, and large. So this is the way you find out about it, and Dan will put the link here, is teamawarenessnewyork.org. But what I want to talk about very briefly is how these programs have been helpful for recovery relevant initiatives. We collected data and we on the pre and post results of this training, and we found improvements in stress management, reduced stigma for seeking help, improved connection to community, self-regulation. And we found, because of a conversation that we had with Jen Gregory, because of the collaborative recovery and empowerment of the Southern Tier, the CREST grant that she received from the Appalachian Regional Commission, that we needed to do a better job of understanding the impact of these programs that I just mentioned on recovery. So far, we've had 11 training sessions delivered by 3 different facilitators to 105 participants in this new approach. We average 9 participants per session. And what we found is that of the participants, 43% have struggled with addiction, and 100% of these individuals believe the workshop could have helped them in the past. And additionally, 95% of the participants know at least one person who could benefit from this workshop. We just want to say here that these are the items that we ask. I want to go through this very briefly because I want to leave time for Q&A and discussion. We asked, do they feel the workshop could be helpful to individuals struggling with addiction, alcohol, mental health problems? Do they have experience with recovery? Are they currently struggling or know someone who's struggling with either mental health or drug and alcohol problems? And here's some quick results. Do you feel that the workshop you experienced today could be helpful to individuals who may be struggling with any type of addiction? Because we cover not just alcohol and drugs, but any type of addictive behavior. And as you can see here, 41% said a great deal, 36% said much. Do you feel that the workshop you experienced today could be helpful to individuals who may be struggling with alcohol or drug problems? And you can see here 72%, much or a great deal. And then finally, could help individuals who are in recovery. So the tools that we're teaching in Ripple Effect, Resilience and Thriving, and Empowered Health Consciousness are useful to people who are in recovery. And the amazing thing is that people more and more are either willing to admit that they know someone who's struggling with mental health or alcohol or drug problems, or since COVID, there's just been less stigma about sharing that information. And so we're able to do a lot through prevention and awareness to help these individuals support themselves and others who might be dealing, giving them tools to help themselves and others who are struggling with addiction, alcohol or drug problems, and or mental health problems.